blood gases, pH, and buffer systems. So some definitions: acids are substances that release hydrogen ions in solution, while bases release hydrogen ions. To maintain stable pH levels in the body, buffers play a crucial role. A buffer is a combination of a weak acid or a weak base and its salt, which helps resist changes in pH when acids or bases are added. The principal buffering system in the blood is the bicarbonate carbonic acid system. This system operates through the reversible reaction. Carbonic acid dissociates into bicarbonate and hydrogen ions and vice versa. Additionally, carbonic acid can convert to carbon dioxide and water, allowing the respiratory system to regulate acid-base balance by controlling carbon dioxide levels. This buffering system is essential for maintaining the delicate pH balance required for normal cellular function. Some more definitions. So acidosis and alkalosis refer to disturbances in the body's acid-base balance. Acidosis occurs when the blood pH falls below 7.4, indicating excess acidity, while alkalosis is when the pH rises above 7.4, indicating excess alkalinity. These conditions can be classified as respiratory or metabolic based on the underlying cause. Respiratory acidosis is caused by an excess of carbon dioxide, which is an acid, often due to inadequate ventilation by the lungs. Conversely, respiratory alkalosis results from a deficit of carbon dioxide, typically due to hyperventilation. Metabolic acidosis occurs when there is a deficit of bicarbonate, which acts as a base, while metabolic alkalosis results from an excess of bicarbonate. The lungs regulate the respiratory components of the acid-base balance by controlling carbon dioxide levels, whereas the kidneys regulate the metabolic components by managing bicarbonate levels in acid excretion. The bicarbonate carbonic acid buffer system is the principal mechanism for maintaining acid-base balance in the blood. In this system, carbonic acid acts as the acid and bicarbonate serves as the base. For simplicity, carbon dioxide is often substituted for carbonic acid in the chemical equation because bicarbonate quickly dissociates into carbon dioxide and water. The lungs play a critical role by eliminating carbon dioxide, thus regulating the acid component of the system. Changes in the partial pressure of carbon dioxide directly influence the rate of ventilation. The higher the partial carbon dioxide levels stimulate increased breathing to expel carbon dioxide and reduce acidity. Meanwhile, the kidneys adjust the concentration of bicarbonate, the base, by reabsorbing or excreting it to balance the pH. Together, the respiratory and renal systems coordinate to maintain the delicate pH balance, which is essential for physiological function. The phosphate buffer system involves the balance between hydrogen phosphate and dihydrogen phosphate. It plays a significant role in maintaining acid-base homeostasis in plasma and the red blood cells. This buffering system helps resist changes in pH by accepting or donating hydrogen ions as needed. Additionally, phosphate buffers are involved in the renal regulation of sodium by participating in its exchange within the urine filtrate. This process helps the kidneys manage electrolyte balance and contributes to the overall acid-base stability in the body. The lungs and kidneys play crucial roles in maintaining the body's acid-base balance and regulating blood pH. The lungs control pH primarily by regulating the retention or elimination of carbon dioxide. By adjusting the rate and volume of ventilation, the lungs can increase or decrease carbon dioxide levels in the blood. Since carbon dioxide combines with water to form carbonic acid, its removal helps reduce acidity and raises pH, whereas retention increases acidity and lowers pH. On the other hand, the kidneys maintain pH by excreting hydrogen ions, which are acid, and reclaiming bicarbonate from the glomerular filtrate. This renal function helps neutralize acid in the body and preserves bicarbonate, which is a key buffer, thereby contributing to long-term acid-base homeostasis. The end product of aerobic metabolism is carbon dioxide, which plays a central role in the body's acid-base balance. Carbon dioxide produced by tissues diffuses into the plasma and red blood cells. Inside red blood cells, most of the carbon dioxide combines with water to form carbonic acid, which is a reaction that is catalyzed by the enzyme carbonic anhydrase. Carbonic acid quickly dissociates into hydrogen ions and bicarbonate ions. This reversible reaction is crucial for transporting carbon dioxide from tissues to the lungs and helps regulate the blood pH. The lungs then eliminate carbon dioxide through ventilation, which directly influences the acid-base balance by controlling the level of carbonic acid in the blood. When bicarbonate ions increase inside red blood cells, they diffuse out into the plasma. To maintain electrical neutrality, chloride ions move into the red blood cells in exchange, a process known as the chloride shift. In the lungs, oxygen diffuses into the blood and binds to hemoglobin, causing the release of hydrogen ions that were carried by the red blood cells. These hydrogen ions then combine with bicarbonate ions to form carbonic acid, which quickly dissociates into water and carbon dioxide. The carbon dioxide is subsequently eliminated from the body through ventilation, and that completes the respiratory component of the acid-base balance. When the lungs fail to remove carbon dioxide at the rate it is produced, carbon dioxide accumulates in the blood, which leads to an increase in hydrogen ion concentration and thus lowering blood pH. Conversely, if carbon dioxide is removed faster than it is produced, such as during hyperventilation, the hydrogen ions concentration decreases, which causes a rise in the blood pH. Therefore, ventilation plays a crucial role in regulating your blood pH. When acid-base imbalance arises from metabolic causes, the respiratory center adjusts the rate of ventilation to help restore pH toward normal. This respiratory response acts quickly, usually within seconds, and is the body's first line of defense, although it may not fully correct the imbalance. The kidneys play a role in the acid-base balance by reclaiming bicarbonate from the glomerular filtrate. Sodium ions in the filtrate are exchanged for hydrogen ions. The hydrogen ions then combine with bicarb to form carbonic acid, which is converted into water and carbon dioxide by the enzyme carbonic anhydrase. The carbon dioxide diffuses with the renal tubule cells, where it reacts with water to reform the carbonic acid, which dissociates back into hydrogen ions and bicarbonate. The bicarb is then reabsorbed into the bloodstream along with sodium, effectively reclaiming bicarbonate and maintaining acid-base balance. Acid-base homeostasis. So the lungs regulate blood pH by controlling ventilation. Hypoventilation decreases pH, acidosis, by retaining carbon dioxide, and hyperventilation increases pH, alkalosis, by eliminating carbon dioxide. The kidneys control bicarbonate concentration in the blood by reabsorbing or excreting it. The Henderson-Hasselbalch equation can help describe this relationship. So that is the pH equals the bicarb divided by the partial carbon dioxide. In healthy individuals, the ratio of bicarbonate to carbonic acid is approximately 20:1, and it maintains a normal blood pH of 7.4. Some acid-base disorders. So we have primary respiratory acidosis or alkalosis. This is caused by changes in partial pressure of the carbon dioxide. So acidosis is an elevated partial carbon dioxide, so hypoventilation, and alkalosis is a decreased partial carbon dioxide, so hyperventilation. Primary metabolic acidosis or alkalosis is caused by changes in bicarbonate concentration, and mixed respiratory and metabolic disorders can occur when more than one pathological process affects the acid-base balance simultaneously. Compensation for the acid-base disorders. So the purpose is the body tries to return blood pH to normal when the imbalance occurs. If the primary problem is metabolic, so the change in the bicarb, the respiratory system compensates by altering the rate of ventilation. For metabolic acidosis, so low bicarb, ventilation increases, so hyperventilation starts to occur, and that helps to try to reduce carbon dioxide and raise pH. For metabolic alkalosis, high bicarb, ventilation decreases, so hypoventilation, and that does that to help to retain carbon dioxide and lower that pH. If the primary problem is respiratory, so a change in your carbon dioxide, the kidneys will try to compensate by excreting or reabsorbing bicarbonate to adjust the pH. For a respiratory acidosis, or a high carbon dioxide, kidneys reabsorb more bicarb to neutralize acidity. For respiratory alkalosis, low carbon dioxide, kidneys excrete more bicarb to reduce alkalinity. So the timing, the lungs respond quickly within seconds to minutes, but cannot fully correct metabolic disturbances alone. The kidney compensation is a bit slower. It can take hours to days, but it is more effective at restoring the balance in respiratory disturbances. As mentioned, the kidneys are slower. It takes 2 to 4 days to fully respond. Despite the slower response, kidneys compensation provides a long-term and full correction of acid-base imbalances. If it is compensated, that means the blood pH has returned to normal, so between that 7.35 and 7.45, indicating that the compensation has been effective. They can also be partially compensated, and that is when the blood pH is moving toward the normal range, but it's not quite there yet. All right, so we have primary metabolic acidosis. The definition of this is it is a primary decrease in bicarbonate concentration, which causes a decrease in blood pH. So the key indicator of this is that the bicarb ratio is less than 20:1. Common causes is administration of acid-producing substances like calcium chloride, or excessive acid production, such as starvation or diabetic ketoacidosis. Can also occur when there is renal tubular acidosis, so if they have impaired kidney acid excretion, or during gastrointestinal bicarbonate loss, such as when you have diarrhea or like intestinal fistula drainage or something like that. All right, so for compensation of this, the body compensates by hyperventilating, so increasing that breathing rate. This causes the lungs to blow off that carbon dioxide, which is acidic, and that helps to restore the acid-base balance. So by lowering that carbon dioxide level, the base to acid ratio returns closer to normal. And then a secondary compensation occurs when the kidneys start to retain the bicarbonate, further correcting the imbalance. Lung compensation happens quickly, again, while the kidney takes a little bit longer. Primary respiratory acidosis caused by excessive amount of carbon dioxide due to decreased elimination by the lungs, or hypoventilation. This leads to an increased partial carbon dioxide in the blood, which lowers the pH. Causes, lung diseases such as emphysema can cause this. Certain drugs like barbiturates or morphine, even alcohol. Mechanical obstruction, so if there's been strangulation or aspiration, and also a decreased cardiac output from like congestive heart failure. For compensation on primary respiratory acidosis, the kidneys will compensate by increasing the excretion of hydrogen ions, which is an acid, and by increasing the reabsorption of bicarbonate, which is a base. So this renal compensation helps to buffer the excess carbon dioxide and restore acid-base balance over time. Primary metabolic alkalosis, the cause is an increase in bicarbonate. The pH is elevated. The ratio base to acid ratio is greater than 20:1. It is caused by excess administration of sodium bicarbonate. It can also be caused by excessive loss of acid or the hydrogen ions through vomiting or through prolonged use of diuretics. The body will compensate, so it's going to respond by depressing the respiratory center, causing hypoventilation, and this will increase the carbon dioxide level or acid to help restore acid-base balance. Primary respiratory alkalosis, the cause is an increased rate of ventilation, which then goes to an excessive elimination of carbon dioxide by the lungs. The effect is there's a decreased carbon dioxide, which is the acid, which goes to an increase in pH for alkalosis. It's caused by chemical stimulation of the respiratory center by drugs, so salicylates is an option. It's an increased environmental temperature, fever, pulmonary emboli, and pulmonary fibrosis. Your body's going to compensate by the kidneys, so the kidneys are going to compensate by excreting that bicarb and retaining hydrogen ions. Oxygen transport by your hemoglobin. So most oxygen is transported to the tissues by hemoglobin. Each A1 hemoglobin molecule can transport 4 oxygen molecules. Normally, more than 95% of functional hemoglobin is bound to oxygen. So oxygen saturation is the ratio of oxygen bound to hemoglobin compared to the total amount of hemoglobin capable of binding oxygen. Partial pressure of oxygen dissolved in plasma, so that PO2 is 90 to 95. It's usually a non-invasive measurement of oxygen saturation, can be done by that pulse ox or pulse oximetry thing they put on your finger. Usually 98 to 99% of available hemoglobin is going to be saturated with that oxygen. Hemoglobin oxygen dissociation curve illustrates the relationship between oxygen partial pressure and hemoglobin saturation. And I would guess you'll talk more about that in hematology. But blood gas analyzers. So they use electrodes. The blood gas analysis is a critical diagnostic tool that measures the levels of oxygen and partial oxygen, carbon dioxide and partial carbon dioxide, and pH in the blood. This analysis helps to assess the patient's respiratory and metabolic status. So electrodes are used as the sensing device. The blood gas analyzer uses electrodes as a sensing device to measure the partial pressure of oxygen and carbon dioxide as well as the blood pH. So the measurement of partial oxygen is amperometric. This means the amount of current flow through the electrode corresponds to the amount of oxygen present in the sample. So more oxygen leads to a greater flow. Measurement of the partial carbon dioxide and pH. So the measurements of both of these are potentiometric. The potentiometric sensing is a change in voltage, which indicates the concentration of the analyte that we're looking for. So the voltage changes reflect the amount of carbon dioxide and hydrogen ions in the blood. The calculated values, some important blood gas values are not directly measured, but they are calculated from the partial O2, partial CO2, and pH values that are measured. The ones that are generally calculated are going to be your bicarb, your total carbon dioxide, your base excess, and your oxygen saturation. Measurement of your partial pressure of oxygen using the electrode. So the principle of your partial oxygen measurement, the electrodes measure the amount of current flow, which is directly related to the amount of oxygen being reduced at the cathode. Oxygen molecules in the blood sample are reduced at the electrode surface, generating an electrical current proportional to the oxygen concentration. Structure of that PO2 electrode is the electrode tip is covered by a gas permeable membrane. This membrane allows oxygen to diffuse into the electrolyte inside the electrode. Once the oxygen diffuses in, it contacts the cathode where the reduction reaction takes place. Some common sources of error in the partial O2 measurement is protein buildup on the surface of the gas permeable membrane, and protein deposits can also block oxygen diffusion, which can lead to inaccurate results. Specimen handling for these, so proper specimen transportation is crucial. The blood sample must not be exposed to room air, which can alter the oxygen content. And samples should be analyzed as soon as possible to prevent changes in oxygen levels and help to maintain that accuracy. Measurement of the pH in PCO2. So they, like I said before, they use the potentiometric measurement. That involves 2 electrodes. It has a measuring electrode and a reference electrode. These electrodes are connected to a voltmeter that measures the potential difference or the voltage between the 2 electrodes. The voltage difference reflects the concentration of specific ions or gases in the solution. So a measurement of the pH. To measure the pH, a glass membrane sensitive to hydrogen ions is used. This glass membrane surrounds an internal silver and silver chloride electrode, which acts as the measuring electrode. Both the measuring electrode and the reference electrode are immersed in the sample solution. The voltmeter measures the voltage difference created by the difference in hydrogen ion concentration across the glass membrane. This voltage is converted to a pH value indicating the acidity or alkalinity of the sample. So measurement of the partial CO2, similar potentiometric principles are applied for measuring this. Specific electrodes sensitive to carbon dioxide changes in voltage according to the amount of CO2 in the sample. The measured voltage is used to calculate the PCO2 level. So setup summary real quick. We have two electrodes, measuring and reference, which are always present. Both electrodes are immersed in the solution. The voltmeter measures potential difference, which then correlates to ion or the gas concentration. All right, so we can also use a Severing-House electrode. The Severing-House electrode is a modified pH electrode, which is designed specifically to measure the partial pressure of carbon dioxide. It adapts to the basic pH electrode by adding an outer membrane that allows selective diffusion of CO2 gas. So the structure and basically how it works, the traditional glass pH electrode is covered by a gas permeable outer membrane. CO2 from the sample diffuses through this membrane into a layer of electrolyte solution beneath. Inside the electrolyte, CO2 reacts with the buffer solution, forming that carbonic acid. Some chemical reactions, so then the carbonic acid rapidly dissociates into bicarbonate ion and hydrogen ions. This reaction increases the concentration of hydrogen ions in the electrolyte. The pH electrode then measures the change in hydrogen ion activity, or the pH, within the electrolyte solution. Since the increase in hydrogen ion concentration is directly related to the amount of CO2 diffused, the change in pH is proportional to the PCO2 of the sample. This allows indirect but precise measurement of carbon dioxide pressure. Calibration for these instruments, importance of temperature and measurement. So temperature is a critical factor in accurate measurement of pH in blood gases. Blood gas values are typically reported at 37 degrees Celsius, which is, body temp. Variations in temperature can significantly affect those readings. Instrument calibration, so most modern blood gas analyzers and pH meters are going to be self-calibrating. These instruments perform calibration at specific time intervals automatically, which helps to ensure consistency and accuracy. Calibration is performed using standard reference solutions or gases to maintain measurement reliability. Instruments are programmed to detect and indicate calibration errors, and if the calibration fails or values fall outside those acceptable limits, the device alerts the operator to avoid erroneous results. This feature helps to improve quality control and patient safety by ensuring only accurate measurements are reported. So calculated parameters. The bicarbonate is calculated using the Henderson-Hasselbalch equation. It represents the metabolic component of acid-base balance in the blood, and it helps to provide insight into the buffering capacity and metabolic status of the patient. Base excess is a calculated value used to assess the metabolic component of an acid-base disorder, and it indicates the amount of excess or insufficient base in the blood. So interpretation of the base excess, if you have a positive base excess, it indicates an excess of bicarbonate or a deficit of non-carbonic acids. This suggests a metabolic alkalosis condition. If you have a negative base excess, that indicates a deficit of bicarbonate or an excess of non-carbonic acids. This suggests a metabolic acidosis condition. So in clinical use, the base excess helps clinicians differentiate whether an acid-base disturbance is of metabolic origin. It is valuable for guiding treatment decisions related to those acid-base imbalances. Specimens for blood gas analysis, so patient status. Always note if you're collecting it, or even if you're not collecting it, it should be written on the label for the patient's ventilation status. So we need to know whether the patient is on supplemental oxygen or room air. This impacts the interpretation of the blood gas results. For collection variables, we need to consider the patient's temperature, posture, and time of collection, as these can all affect results as well. The syringe type, you can use a glass syringe. The plunger can react with arterial pressure, which may affect sample integrity. You can also use plastic syringes. These are going to be preferred for most collections. Do not ice the specimen if we're using a plastic syringe unless the delay before you can run the test is more than 20 minutes. We want to avoid contamination, so we're going to remove air bubbles carefully to avoid contamination as air can alter the gas measurements. For the anticoagulants, you're going to use heparin. You're going to mix the sample thoroughly to prevent clotting, but avoid excessive agitation as that can cause hemolysis. Quality control, so there is commercial liquid controls that are already prepared for routine quality control. These controls have known values to ensure the instrument accuracy. We're going to duplicate analysis, so we're going to perform duplicate analysis of patient samples on separate machines. This can help verify consistency and reliability across instruments. Levels of control, like everywhere else, there's 3 levels of control: low, normal, and high, to help cover that analytical range. And we're going to make sure to use some delta checks to monitor shifts or trends in the patient results over time. QC should be prospective, meaning it's performed before patient samples are tested, just like every other test, right? The instrument must be pre-qualified by passing QC checks to ensure results are valid.